welcome to Well Within Reach. And I'm Dr. Neva White. I'm so happy today to have our folks from Mental Health Partnerships here. And just going to go around and just introduce everyone who's here today. And then we're going to get right into our questions and information. We have the Chief Executive Officer, Dr. Janine Lisitsky, here with us. She is the President and Chief Executive Officer. Let me get her title correct. And then we have Amber Ballinger here, she's the Division Director. And then Lee Braden is the Director of the Institute. So Dr. Lisitsky, can we start with you just to tell us about mental health partnerships and give us a little background and information?
Sure. This year, we're in our 75th year. So we started in 1951, and the folks who started the organization had a focus on bringing to light mental health challenges and what could be done and really advocating. So we started as an advocacy organization, pushing for things like deinstitutionalization and community-based services for people experiencing mental health issues. And all along, we always focused on the voice of people with lived experience to determine what was needed and how we would grow as an organization. And today, over the years, because we were so successful in bringing about advocacy changes and getting new services and support, we got into direct services with some of the services that were most important to people with lived experience, such as residential support programs, as alternatives to hospitalization, case management, and peer support was particularly important. And we're going to talk about that a little bit later in today's podcast. But now we serve about 12,000 people a year in 3 different pillars: direct services, education and training, and advocacy. And our direct services are basically in southeastern Pennsylvania, but our training is statewide. And also we work in Florida as well with our education and training division. And we do advocacy on a national, state, and local level. Much of what we do now is peer-driven and peer-led. So we're, really encouraged by the hope that we experience day to day in working with our participants and also with all of our staff, many of whom also have lived experience.
So thank you for that. So today we're going to talk about certified peer specialists. And Amber and Lee, could you tell us what is a certified peer specialist?
So a certified peer specialist is an individual that has mental health or co-occurring diagnosis, condition, or challenges, and they undergo a 75-hour training and take an exam to become certified by the Pennsylvania Certification Board, in order to be able to use that lived experience to help others in recovery. It's an evidence-based practice for individuals with lived experience to be able to assist those with that are undergoing their recovery at this time. And they are able to assist them in identifying personal goals that they would like to work on and work towards, and assist them in breaking it down with action steps, interventions. They give hands-on assistance. And Lee can speak more in regards to the actual training that goes into it, but they learn different ways to use their lived experience for the benefit of those going through similar situations that they have. And a lot of times they get into it because they've gone through a process and someone was instrumental in their recovery, whether it be inpatient or outpatient, and saw something in them and encouraged them to go through the training because they felt like they could impart, be a valuable member, imparting this into those that are, going through similar situations. But I'll let Lee speak more towards what all goes into the process of becoming a CPS.
I just will add to that, the unique thing about a CPS is, we all understand mental health services, right? You can see a therapist, you could see a psychiatrist, you could go inpatient, you can have you can have intensive outpatient. But what you can't have in the typical clinical system is someone who understands what you've been through, who's available to be with you many hours a week, very flexibly to do things that are on your goal plan, what you want to work on. So it's a position that can really help to avoid rehospitalization, avoid falling back into homelessness or other things because of the lack of that community based hand in hand support that peers offer.
Yeah, and I'm sorry, just to touch back, piggyback on what Janine was saying. Yes, absolutely. It's the evidence indicates that peer support lowers the overall cost of mental health services by reducing the rehospitalization. We're able to go in and be part of the aftercare plan, bridge the gap. So, reducing not only the hospitalization stays, but also the days spent inpatient, which is being able to be reduced and increasing their follow-up with outpatient services. So the step down. A lot of times people they are discharged with appointment 2 weeks from now. So what do you do in the meantime? So we're able to come in as a support, being actual part of their aftercare plan to help them with their follow through. It just gives a increases the quality of life and the holistic health. Peer supports are very instrumental on not only bridging the gap, but also helping the helping the individual follow up and advocate for themselves with the rest of their treatment team. So their case manager, therapist, something like that. If the medicine is not working, how to advocate for yourself, how to speak up for yourself, how to, identify the needs that you need. And connection. So we do a lot of connecting to resources, trying to reduce all the social determinants of health, food access, access to primary care physicians, access to uh, housing options and supports.
So let me just ask this. Have you seen, as a result of certified peer specialists in the mental health service environment, what are people saying who are actually being provided these services? Are you seeing better outcomes, better responses? How are people, what's the overall impact, I guess?
Absolutely. We're hearing that the quality of life has increased because they're seeing hope uh through those modeling it in real time. So they're seeing hope is possible in their recovery. To have a meaningful life is possible in your recovery, and the CPSs, certified peer specialists, are leading by example, and they don't have it all together, and many of them continue with outside support for themselves too, so that they are able to maintain that level. They some CPSs have a CPS, outside CPS, they have therapy, and then along with that, mental health partnerships is very big on the work-life balance. So we also encourage employee assistance program where they have access to 24/7, just a phone call away for that, and able to talk with someone for a few brief sessions. And if they need more, they'll connect them to in-person sessions. But yes, they have a lot of our CPSs have a strong support system in their own personal life. And so they are able to, balance the work-life balance and be able to pour into the individuals.
Okay, well, Lee, get you to jump in here.
Great. Thank you. Yeah, so my name is Lee Braden. I'm actually the division director at the Training and Education Department at Mental Health Partnerships. And we were established, this program was established in 2004. We were the first training program in the state of Pennsylvania and the second in the nation to both develop the curriculum and teach the course on becoming a certified peer specialist. So back in the early 2000s, peer work was a very new concept. And it really kind of emerged out of people who had lived experience, like Mary Ellen Copeland, and who were really focused on this alternative way of kind of treating mental health conditions and, empowering the lived experience of people who have mental health conditions to provide support. And so the Institute, Mental Health Partnerships was actually invited to author the first curriculum on becoming a certified peer specialist in the state. And we have been teaching that course ever since. That course was developed originally by individuals with lived experience and continues to be maintained by individuals with lived experience. All of our trainers are certified peer specialists. Our curriculum developer is a certified peer specialist. Our managers that run this department are certified peer specialists. We have a training staff of 5 full-time trainers that train anywhere from Philadelphia to Erie, Pennsylvania. We have contracts across the state of Pennsylvania, and we teach the CPS course. The CPS course is monitored by the Pennsylvania Certification Board. So individuals that complete our 75-hour class can then sit for an exam to become certified through the Pennsylvania Certification Board. That certification allows employers, when they hire CPSs, to draw down funding from Medicaid in order to pay for their work, to pay for their hours with an employer. And so MHP, I love MHP. It has such a beautiful history of social justice and advocacy for folks with mental health conditions. Being a part of being one of the first pioneers in this education just makes sense coming from mental health partnerships, given our history and what we've always done, which is elevate the voices and experiences of people who would be otherwise marginalized and, have to live with stigma. And so I think that, anecdotally, I feel like the impact of peer work in the mental health field is pretty profound, and that I think a lot of people in this field are beginning to understand and appreciate the value of one's lived experience. And so you can see that even in therapists, they may share that they have not in a therapeutic setting, but they will share that they have lived experience with maybe in recovery with drugs and alcohol or a mental health condition themselves. And so that is really the power and far reach impact of peers entering the workforce and working alongside other mental health professionals. I think that one of the beautiful things that peer work does is that it can reach people in communities that might not otherwise seek out mental health support, right? Because there's stigma associated with it, or there's a lack of understanding of how mental health support actually works or what a mental health condition really is. And so, if you have someone in your community that you trust, that looks like you, that shares cultural earmarkers that you share, and they come to you and they talk about your mental health, you're more receptive to receiving that information. And so, in a lot of cases, peers can become a bridge for individuals needing support. And so there's just so many areas and ways, and Amber really spoke about this, that peers have enriched the mental health community and have really helped people gain access to mental health support.
And I would just add a few things. One is being a CPS reinforces your own recovery. And often we see people who have been on disability roles and medical assistance roles who get their training, get a full-time job, and now they're coming off those roles. So I think it's an incredible way to get people with lived experience also back into the workforce. Although that I don't want to mischaracterize. It's not everyone who becomes a CPS that's on medical assistance and disability, but there are some. So it's just an amazing role that, in my mind, is double duty. It reinforces the peer's own recovery, and then it's supporting others on the journey. Earlier, you asked a question about how do we know it's successful, and we have a homeless specialty in peer services. It's called PeerNet Homeless Specialty, and there's so many stories of people who, because they had that peer, they avoided falling back into homelessness, or they were able to get housed and they're stably housed. So I mean, that in and of itself is just an amazing outcome, because we know that housing is our basis of all wellness and health, right? If you have no safe place, then you can't build on those other things.
Wow, I've learned so much in such a little bit of time. In our work that we do at the Frazier Family Coalition for Stroke Education and Prevention, I could see the role of the peer specialists coming in. How do we, I want to go around as we conclude, and I want each one of you to kind of give us a word for those of us who are in the medical clinical setting and in areas where we don't have access to mental health services as we would like to. What are the opportunities that you all see for us to employ and work with certified peer specialists in our setting that could really enhance the quality of life for those individuals that we work with who have, a whole host of issues in addition to their medical health, dealing with their diabetes or high blood pressure, and then all these other things. So if you could kind of go around and give us, some hope, as you guys say, that's you focus on hope for where we are, in the Jefferson settings and the Temple settings.
I'll just start quickly by talking about financial models for how to do this work and to expand it more broadly. For example, I believe that there are ways to tap into Medicare as a paying source, because right now we tap into medical assistance, but I've also heard a pilot of a private insurance company funding this service. So that's another avenue. And a third potential avenue would be to work with an employee assistance program to get it incorporated into their services that they provide. But we are very interested in, future partnerships where we can develop these kind of new models of expanding peer support broadly.
And I was just saying, like, so when folks go into the hospital for medical issues, we still support them, and we will visit them and meet with them and their treatment team in a most appropriate aftercare plan. Um, because we are focused on the holistic wellness. Um, so and first of all, I also want to say real quick to reference something that was said in the past. Our CPSs have a wide range of backgrounds. So we have some with double masters down to GED, down to those that have a full career and have decided to make that change because something in them spoke to them where they no longer felt fulfilled, or their career prior was maybe not as not as conducive to their behavioral health needs. So I do want to say that. So it's a wide range, but also peer supports, we don't remove their independence. So a lot of times the clinical teams are telling them what they need to do, what they have to do to reach this, and what steps they have to do and what they need to do. So the peer support can help the treatment team, the clinical team, in putting it in terms. They're not talking in the medical jargon. They're able to identify with them, and they are able to help them find in themselves what they want to work on in relationship to that. So we tend to have linkage meetings with all of their supports, whether that's family, whether that is clinical treatment teams, and if they're in the hospital, we and if we are allowed by the participant, we try to reinstill their independence, so it's not taken from them, but they are able to dictate their own care, and we are there to support them and assist them in advocating for themselves, so that they're provided the best care possible, and one that they are going to be active in and actively engaged in. So I think and you'll find that a lot of medical teams are incorporating CPSs now on their teams for that very reason, so that they're able to, have improved engagement and not, feel like they're talked at, but and they're able to explain things, and be able to just kind of be that added support that's able to walk with them through certain situations.
So I think that if I can share just anecdotally a story that's personal to me, the majority of the employees that work at mental health partnerships are people with lived experience. In fact, a lot of our employees are CPSs themselves. And if they don't have personal lived experience with mental health, the other portion of us are people who have loved ones in our lives with mental health conditions. And I and my wife have our son has mental health conditions, and so we are all very driven to do this work, and it touches us in a very personal way. And we were seeking treatment for our son, and I just kind of tumbled into this amazing experience where we were seeking treatment for our son, and we stepped into a model where we were assigned a therapist, a psychiatrist, and two certified peer specialists. One of them to work with our son, who was a young person, the same age as him, and struggling with the same issues that he was struggling with, and one to work with my wife and I, who was a parent. And I can honestly tell you, I was so thrilled because I had no idea this was going to happen. And I was like, oh my God, this is what we do. And, but I will honestly tell you that I got to experience firsthand the power of peer work. And, that parent who helped us as a peer was so instrumental. She got right in there with us. She was able to spend more time with us. She helped us navigate issues that we were having in the public school system and making sure that our son got the needs, like certain services that he needed. She helped us, draft educational letters and advocacy. It was fantastic. She also was just incredibly empathetic to our own journey, and didn't say like what we needed to do as parents, but just said, I know what it feels like because I am a parent with a child who has a mental health condition. And then for our son, he was able to connect with a young person who was a CPS who was on a similar journey of recovery. And that was just so transformative. And I thought, well, this is beautiful to get to experience. And really, I wish every family, every individual, irrespective of where they get their mental health from, could have access to peers. And I feel like that's a huge gap that we're missing, is that I think that a lot of people don't get to tap into the powerful work of peers because mental health models don't always have peers working on their treatment teams, but they absolutely should, because it is, it's really helpful. And so that is why I think all of us get up and go to work and feel so proud of what we do, because we have lived this experience in some way or another, and we see the power in the transformation that takes place when people are partnered with individuals who have lived experience, who have actually been where you've been, and be able to kind of meet you where you're at. So anyway, I wanted to share that as a story of hope, and just say, like, mental health is something that a lot of families struggle with. It's more common than people want to talk about, and mental health partnerships provides a unique and different perspective on how to help folks. So thank you.
Well, well, I think first of all, we want to thank you for sharing. It was very powerful what you just said was extremely powerful, and I think it brings everything that everyone says to life. So I thank you all for being here. I'm just going to ask Dr. Lisinsky to give us our final word before we conclude today.
Just, I think, to hold out hope when people and families are struggling. There's so much hope for tomorrow, and peers really hold so much of that power to walk along the journey. So, and also reach out. There's a 988 hotline for people who are struggling. Even if the hotline doesn't have what they need, they can give referrals. And Mental Health Partnerships also has a chat line that's staffed by peers. So people can go to our website and link right in and start typing and be talking to a certified peer specialist. And anyone can do that. So the final word is, don't go it alone. There's hope. There's people here to support you. And yeah, we're here when you need us as well.
Thank you all so very much. Take care.
Thank you.